Why does your shoulder keep on dislocating again and again? Hello doctors, I am Dr. Aditya Sai and welcome to our channel of the Shoulder and Knee Clinic, where we discuss about various issues regarding your shoulder, your knee, sports injuries and how we can treat them. So a problem which people frequently encounter is the issue of shoulder dislocation. So how does it happen the first time? Especially somebody has sustained a trauma, has an accident, or somebody was playing a overhead sports and they felt that the shoulder came out. It probably will be the most painful thing you have experienced. Sometimes it goes back on its own, and sometimes people would have had to go to emergency department, and some doctor would have put it inside. So once that initial episode passed off, then out of 100 people, maybe 20 start experiencing that the shoulder keeps on dislocating again. Now we need to see why this happens again and again. If you see at the shoulder, it's a ball and socket joint where the ball is round and the socket is relatively flat. So inherently your shoulder joint is unstable. Now there are ligaments around the shoulder which provided stability. Then there is the force of the rotator cuff muscles which add stability to your shoulder. After the first episode of dislocation, generally there is a tear of the ligaments that hold the shoulder in place. And depending on the age of the individual, further things happen. So if somebody is very young, let's say below 20 years of age, the ligaments and everything is lax, tissues are lax, so they heal in a very relaxed position, and as a result the ligament is not tight, and that's why these individuals keep on dislocating their shoulder again and again even after the first episode. Whereas if you see somebody who is 45 years of age, tissues are relatively stiff, and after the first episode the risk of redislocation is less because the tissues heal properly at the correct place. The third age group is somebody who is 70 plus. Not only the ligament tears, but the tissues or the muscles or the rotator cuff are degenerated, and tears of that can lead to recurrent dislocation of the shoulder. And once the rotator cuff is completely torn, then it's very easy to dislocate the shoulder because it's a dynamic stabilizer of your shoulder joint. So typically people, when they are doing overhead activities, reaching out, let's say doing a serve for tennis or badminton, they are doing a smash. Sometimes even when you sleep, shoulder can dislocate. Somebody is doing a bench press in the gym, that's a common mechanism in which the shoulder can dislocate. So when do you want to meet somebody for it? Well, if you have had multiple episodes of dislocation, if your shoulder is dislocating in sleep, if there is pain in the night when you sleep, if you're a young person below 20 years of age who has just dislocated your shoulder, or somebody who is engaged in contact sports, so you are at a very high risk of dislocating your shoulder again and again. If untreated, it can lead to major issues, especially wear and tear of the glenoid bone, and that may necessitate major invasive procedures to correct the problem. So once you visit a specialist, a shoulder specialist, then you will be diagnosed with what problem you are having. Essentially, how do we manage this? So a lot of times, especially in people above the age of 30, the first episode of dislocation can be managed non-surgically with physical therapy, rehab, activity modification. In people who are younger than 20 years of age, um, surgery is required even after the first episode of dislocation, because they are at a nearly 100% of risk of redislocating their shoulder. Somebody who has associated muscle tears in the shoulder is again at a very high risk of redislocating the shoulder. So these are the high risk groups which need more aggressive treatment. Sometimes you have individuals who have an associated fracture of the glenoid or the bony bank cut. Again, these are individuals at a very high risk of dislocation. So we treat them quite aggressively. Elderly people who are around 70 plus, who have big muscle tears, if not addressed, that can not only lead to shoulder dislocations but the loss of ability to lift the hand up. So that's another important age group that requires aggressive treatment to prevent a recurrence of the problem. So treatment of shoulder dislocations as such is very wide topic, and I believe that needs to be covered in a separate video. But if you know somebody who is repeatedly dislocating their shoulder, then you can ask them to see this video and share, like, and subscribe our channel. It may be informative for them and may give them guidance with regards to some answers they are looking for. Thank you and keep watching.